So there's new regulations that have come into force and will be laid before the next sitting of Tynwald, which basically will allow for us as a department, if necessary, and as a government, to force people to isolate and enforce checks. It's purely a precautionary measure. It's exactly the same, mirroring what they've done in England and Public Health England has recommended, but it allows us to introduce those checks and, if necessary, forcibly hold people for isolation if they won't actually comply with it.
So those checks, would they be at the airport and the sea terminal?
If we decided to go down that route, I've got to emphasise again, these are precautionary regulations that if the situation was to deteriorate, it's a sensible thing to have. At the moment, we've no intention of using those powers because that's not the public health advice to do so, and testing at ports has been proven worldwide not really to be an effective measure. But the precaution is there if we need to use it.
What would have to happen then to go down that road?
I think you would probably have to reach a pandemic stage or, in fact, a serious public health emergency.
Well, it is around the world, though, isn't it?
It is around the world, but if you look at the UK at the moment, even with the additional cases declared yesterday, in terms of spread and population, the vast majority are still people who have travelled to other regions and have come back with it. The number of human-to-human transmission cases in the UK is still relatively low.
At this stage then, and we're getting a lot of comments into the Manx radio itself, that we've got a fairly big motorcycling festival coming up fairly soon. It's the start of the cruise ship season now. This time of year when we're getting more and more visitors. Should not we be extra cautious right now and putting maybe over the top checks in place, but protecting us?
Well, over the top checks aren't going to protect us, to be perfectly frank. You've got as much chance of someone stepping off a cruise ship and carrying the contamination as you have someone flying in from Bristol today on an aeroplane. Over the top checks aren't going to do anything. We referred briefly to the checks at ports. I don't think a lot of people understand what those checks actually are. They're temperature checks. So it's checking if people have got a fever. We have to remember this virus can have up to a 14-day incubation period, and not everyone, even when they are showing symptoms, shows a fever. So even the port checks has been shown worldwide doesn't necessarily stop the spread. What is important is that if cases do emerge, we have the powers and ability to force people to isolate, to be able to get them out of the chain to pass human-to-human transmission, and that's what the focus is on. In terms of TT is quite a way away still, but as the situation develops, we are looking at it daily. Public Health is involved with Public Health England on a daily basis. There is another call with Public Health England today at 2 p.m. To talk about this developing situation, and we will mirror the responses of anything in Public Health England. But I need to stress again, even at this stage, the risk is still assessed as moderate to low.
The checks you mentioned are temperature checks, airports and the sea terminal, if they were to come into place. How long does that take, and how is the equipment there already, essentially? Are people equipped to know what they're looking out for? Because these are people working at ports, they're not health professionals.
Yeah, I mean, obviously Public Health would assist the ports in the event that we did decide to use those checks. I do need to stress again, at the moment there is absolutely no intention to do so, because again, the robustness of the checks, again, worldwide has shown that that's not necessarily going to be necessarily helpful in preventing spread. But what is important, like I say, is to emphasise is the risk is still low to moderate. We have had tests on Ireland, but I want to dispel some rumours that have gone round at the weekend. Nobody to date, as of literally as I'm sitting in this studio, has been diagnosed on Ireland with coronavirus. All of the tests that we've undertaken have come back negative.
When these tests are taken, are people being held in isolation? So
they are self-isolating, or in the event of one test, because they developed medical symptoms, they were isolated in the hospital. But it came back negative that it was something else that they were suffering from. But I do need to stress that again, because I'm aware over the weekend there's been more rumours that people have been diagnosed on Ireland. That at the moment in time is completely and utterly incorrect.
A lot of people are critical of the low to moderate risk, saying it's actually a much wider risk. What can you say to that?
Well, if you look worldwide at the statistics, that's not the case. China still accounts for 95% of all cases worldwide, even with the blips that have been seen outside. when you put it into a category, for instance, you look at winter influenza and the issues that develops around the world each year, what makes this virus different is obviously its contagion and spread. But in terms of the serious nature and those that are put in a critical condition from having the virus, it is still, in terms of global health, relatively low. But it's something we do take seriously, and public health, like I say, will react accordingly. But the important thing is not just that we have an appropriate reaction, but we don't have an overreaction as well.